When a loved one or family member's health deteriorates to the point they must move in with you, everyone's life changes. You'll find yourself in many stressful and perplexing situations. Caregiving Tips A to Z, Alzheimer's and Other Dementias by Starr Calo-oy takes the family caregiver through every hands-on procedure necessary to care for your loved one at home. Every difficult situation the family caregiver faces is addressed, and numerous ideas to solve them easily are provided. This complete caregiving manual will help you and your family effectively communicate with all medical professionals to obtain maximum results for your loved one. Caregiving Tips A to Z, Alzheimer's and Other Dementias is colorfully illustrated and has been done in large print so it's easy to read. Providing complete care for a loved one is very noble. The proper caregiving tools will make your endeavor easier. Get your copy of the book today. Caregivers A to Z, Alzheimer's and Other Dementias by Starr Calo-oy. Available at caregiversadvice.net. caregiversadvice.net. That's caregiversadvice.net.
Your loved ones, it covers many aspects. One of those is helping with some of the mental challenges your loved one faces. Well, this week, our caregiving expert Starr Calo-oy tackles dementia and violent behavior.
And we are back with Starr Calo-oy here again with a Caregiving 101 advice. And so today we're talking about violent behavior and dementia.
Yes.
Talk about that.
Well, it's very, very difficult for a family member who's seen their mother all their life be gentle, sweet, easy to get along with, and now they are full-blown violence, angry behavior, throwing things, biting, kicking, hitting, pinching, everything. We've seen this kind of behavior happen because, and the thing is, a family member, Eileen, has to remember that they're not being themselves. That isn't really their mother. Their brain has been affected, and that's what dementia is. It affects the brain.
So this is the mom that they, this is not the mom that they knew when they were growing up.
Exactly.
The dementia has certainly kicked in.
Yes.
And so there are some reasons and there are some solutions that you want to talk about.
Yes, yes. One of the things may be pain, for example. They may be experiencing pain somewhere. I'm sure that, well, you won't remember this. You're too young. But back in the days when there were diapers with pins and, you know, pins in them, they used to use cloth diapers. Well, if the pin came undone and the baby's screaming, the first thing the doctor always said is check the diaper, make sure the pin hasn't stuck the baby. Well, by the same token, people with dementia, they're experiencing pain and can't verbalize that they're having pain. We need to check everything and make sure there's no pain going on here. It may be pain in a particular area, so be alert and be aware so that you can eliminate that. It can also be fatigue. They may be exhausted, worn out, and if so, you know, I mean, I get grouchy when I get tired also. Most people do, but even more so for someone with dementia. So we want to make sure that they do get their rest and that you get your rest as well.
Even somebody without dementia will have a hard time expressing just why they're feeling the way they are. So
that's right.
You can only imagine what it's like for them.
And wrong medication. Many times one medication is having an adverse reaction. Now we see that happen in its extreme case with like Heath Ledger. You know, that was an extreme case. But it happens with elderly all the time. We need to check with the pharmacy and let them ask them, well, my mother's taking this and this and this and this. Are there is there anything there that's going to hurt her? And by the same token, doctors, she may have a family physician, a neurologist, endocrinologist, all of these different doctors, and they don't know all the meds that they're taking. And if so, it can end up hurting them and causing them to get violent. It can also be the wrong medication as well. So you have to be patient and allow the doctor to continue to do that. It can also be noise. Noise is a huge thing. Oh my gosh, get them out of the way of noise. Noise confuses them. They're receiving noise in a different way than we do, being well-minded.
Right, so be conscious about that. Let's talk about solutions too, because there are a lot of solutions as well.
Absolutely. Well, one of the things you're going to want to do is check and see if they're wet, if they're wearing wearing diapers because that makes them uncomfortable. Remember, they usually cannot verbalize, listen, I need you to change my adult brief. I need you to help me with this. They aren't going to say that. So check in and make sure that they stay dry. Make sure they haven't got a rash. Make sure that they're clean. They may be hungry or thirsty and not able to tell you. Can you imagine if here you are in a room and there's all these people and you're saying to yourself, you know, I know something's not right here.
Right.
And I don't know how to say it. If I could just find someone to tell I have to go to the bathroom, but they can't verbalize that. They're afraid. They're feeling fear. All of these things can cause them to become angry. We call it a catastrophic reaction. And it can really, really mess things up. Also, you're going to want to stop that activity right away if you see something stressing him out, and it may not be his best time of the day. You'll be able to tell as a caregiver what time of the day you can get the best out of him. And what you want to do is cause the appointments to be at that time of the day.
One last solution, because we're running out of time, so one last solution.
Okay, for violent behavior? Well, let's see. Don't argue with them. How about that?
Oh, that's a good one.
Don't fight. Don't argue. You're not going to win anyway, and all you're going to do is probably cause a violent person to hurt you. I have broken blood vessels under my makeup, and that's why I wear quite a bit, because I got in the way of a violent person's reaction.
Right.
And I learned that a long time ago.
Exactly.
So you just smile and walk out of the room, leave them alone for a while.
Yes, exactly. Yeah, that comes with a lot of patience. Okay, so of course, if you missed it here, don't forget you can always buy some of Starr's books, and she certainly has some great advice. Caregiving 101. Thanks a lot, Starr.
521-8668. Okay.